My name is Valerie Greer. I'm an architect and an assistant professor at the University of Utah. And I'm really excited to talk about age-friendly places from both research into design, and to really think about how our health is connected to the places we live. I'll start with this image because I think we're wired from birth to connect with the places where we live. Our bodies, our senses, our primary source of intelligence, and we recognize that our first and immediate way of knowing our world is often through the places where we live. So let me just share three studies at a high level to illustrate this point. In 1972, researchers interested in awareness and environmental response among newborns designed an experiment where infants were placed in a crib with a mobile hanging over them. Some of the infants had a smart pillow, which when the infants turned their head, the mobile would turn as well. And other infants, the control group, were placed in the same crib, same mobile, but no smart pillow. At 1 day old, the babies in the crib that turned with the mobile turned when their heads turned, were moving twice as much. By age 7 days old, those babies were moving 4 times as much. This really simple and elegant experiment was one of the first that changed the way that we understand how our bodies are wired to our environments. Several years later, a study was done that's really important in understanding our relationship between noise and cognitive development. This study was done at the Bridge Apartments, which are 32-story buildings that span a 12-lane highway that connect New York and New Jersey. Now the cohort of grade school-aged children who lived on the lower levels, unsurprisingly, had significantly lower rates of reading and comprehension and cognitive development than the children who are living on upper levels, right? Because the noise matters to how we learn. And more recently, we've had numerous studies that have been done to understand the relationship between daylight views, which we have lots of in this room, and our ability to concentrate within workplaces. So looking at rates of drowsiness, looking at mood, looking at employee retention, and a number of things that really show eye strain, headaches. Our physical health is really, really wired. And this is important because we spend 90% of our time as Americans in indoor environments. And while we can begin to numb sometimes to the places where we are, we become accustomed to, what we really know is that we have really intelligent relationships with our environments at many, many different scales. My background is as an architect, not as a researcher. I practiced at the global firm HOK for 12 years, and I mostly worked at large scale and complex building types like airports and laboratories. So I love this room of planners and designers because you think big and you're not afraid to think big. And I think that's so important. I also taught design studios for undergraduates and graduates at my alma mater at Washington University in St. Louis. And it's from those sets of experiences that I really began to become interested in places and types of places and then types of health and well-being outcomes. It's the primary charge of an architect to look after the health, safety, and welfare of our environment. And I think it's important to define that not just as having handrails and guardrails and slip-resistant surfaces, which thank you very much, but also to thinking about broader definitions of how we support health and well-being over the course of a lifetime. What I love about design is the process of transformation. So this is a project I worked on. I love working on early sketches, early models, and then seeing the development of how they become spaces and live spaces. It is a lot like child rearing. It's like a small birth process and a ton of work every single time. And I love that. That's what I was doing at age 40 when I had a child, and the experience almost killed me. So for those of you in the room with kids, you might be thinking, yep, my kid is really killing me too right now. But in my case, I literally almost died in childbirth. And that really changed the way I began to think about health and design in a different way. I really dove into research, and I became interested not necessarily just in clinical health, like healthcare hospital settings, but really in the settings that make up our everyday lives. So these are photographs of a study that I'll describe in a minute that was done looking at older adults in Salt Lake City. We're really interested in this study to ask older adults to show and tell us what their experiences were like during the COVID pandemic and what it was like to be sheltered in place. And so I think that one of the things that is important is within this context, we know the zip code paradigm, just that our life expectancy is better indicated actually by our zip code than by our DNA sequence, and that we can, so for instance in this map, predict about how long we will live based on where we live. And you can see in this graph on the low end of the age spectrum in the red, on the high end in blue. And if you take note of the numbers, that delta is 40 years. That's really significant in terms of thinking about how environments are impactful to health outcomes. And this is just mortality. This is not necessarily even quality of life, right? But when we're just thinking about quantity, we know that these disparities are not natural phenomenon, right? But they are the result of social and physical and economic constructions. And those things are really important as we think about how we understand the relationship between health, environment, and well-being over the course of a lifetime. So, what is an age-friendly place? We've talked about this a bit today, and I know this is a bit of just kind of preliminary definitions, but just to be kind of clear, we recognize age-friendliness as sort of being originating with the World Health Organization's dual response to both rapid urbanization and then rapid population aging. And so while we look at age-friendly places, and these are sort of the 8 domains that are recognized as being supportive of older adults, what we see is that connection between the variables and the kind of factors are being quite a bit more complex than just the infant and the newborn and the mobile, right? But here we have multiple factors that are overlapping. And so when we think about what makes an age-friendly community, it's not an easy subject or not an easy topic to study. It's also important to recognize age-friendly communities as being both local as well as global. For those of you who remember back when the World Health Organization started the definition of an age-friendly community, it actually started with a series of focus groups that engaged 39 cities across 5 different continents to define what that meant, right? Kind of really recognizing that there are fast-aging cities and there are slow-aging cities, and those are really different contexts. And so in the same way we recognize the diversity amongst older adults and know that we need to question the sort of homogeneity of what we often characterize as being associated with needs of older adults, we also need to recognize that the places we live are also incredibly different and diverse. So why do age-friendly places matter? You probably have seen this, but the sort of transformation from the pyramid to the pagoda, right? And kind of beginning to think about the change that will happen at a really massive scale. I think one of the questions is then, how do we link what we know between research and what we see in our communities, as well as with the design of places that impact people's daily lives, and also how do we begin to define what those environments might benefit from moving forward. So what I'd like to share with you this afternoon are just 3 different participatory research action methods which are aimed at co-creating knowledge of age-friendly spaces. I really like this quote, and I usually don't read from my slides, but this comes from a researcher in Denmark, and I think it's really important to just articulate this premise, which is stated: instead of conceiving older people as a social problem or burden, new discourse constructs aging as a positive process and emphasizes the active roles older people continue to play in society. And I think that's a fundamental shift in ways that we have historically, or maybe it has been talked about within the context of aging. So the 3 studies I'll talk about were all conducted at the University of Utah with the HARP lab. My director, Andy Hong, Dr. Hong is over here. And I'll describe the research teams and the research questions that that we have been pursuing, but I think one of the things I want to just call out on this slide is just that they're really different. So they're different scales of that I'll describe us working in, but also different types of research methods. And I offer this as a way to begin to think about how it is that we take the knowledge of the importance of asking the question, right? That's what design really starts with, is trying to understand problems and complex things. And how do we begin to embed a question around healthy aging and place to all of the projects and the scopes where we go? Because that's really our opportunity, whether you design buildings or you're designing cities or you're providing social services, there's always sort of a need to begin to understand in a critical framework what the real questions are. So these are just 3 studies. The first one is titled From Sheltered in Place to Thriving in Place, and it really focused on what it means to age in the right place during the pandemic. Some of the background behind this research recognizes the difference between aging in place, which involves supporting people in their choice to live as long as possible in their homes and communities. And that's often very different from what it means to be aging in the right place, or sort of a place where the place where a person ages is optimally fit to meet lifestyles and vulnerabilities. And we recognize this as something very fluid and happens sort of in real time. But the idea behind this study was within the context of COVID, where everybody was in a really unique situation, what really characterized sort of a rightness of place. And again, this was for older adults. We had kind of recognized, and we all saw some of these challenges that came out of the COVID. And these are questions that face the physical environment, but also very much a social environment. And it bridges to think about how technology intersects with our worlds, as well as then what mechanisms are in place to continue social connections. We saw a lot of caregiver burnout and a particularly high amount of disparity between socioeconomic and demographic groups. So the 2 questions we asked were, how do older adults characterize aging in the right place during the pandemic, and how has the pandemic impacted attitudes and outlooks to aging in place? We know that 95 to 98% of people identify the desire to be aging in place, but what does this really mean, especially kind of in a really tough set of conditions? So on the right-hand side, this is the team, and as you can see, we represent the College of Architecture and Planning, but also the College of Social Work, and we had 2 research assistants working with us as well, one of whom is now a social worker and one of whom is in medical school. So it's really nice to be able to bring students along on this from different disciplines and to begin to think about how aging is embedded not just in our work and our design, but also within our research and our teaching. So photo voice, for those of you who aren't familiar with it, is a research method that is designed to really give people, individuals, their own voice to discuss salient issues. And so it starts with an open-ended prompt, and it allows researchers then to visualize perceptions and narratives to see into everyday realities. And this is something that has been done historically to help promote conversations with stakeholders, to help prioritize, because stories are important. They embed a lot of knowledge, and they contain themes, which is what we look for. So we recruited 17 older adults who participated for a week, taking 3 pictures a day, writing down words. We asked them to do captions or kind of bumper sticker quotes is how we termed it for their pictures. And so these are just some of the samples. So these were all people who were sheltered in place during the summer of 2021. And our process was, after recruiting and doing an orientation, setting them about to take their photos, collecting the photos, and then doing 2 different sessions, one individual to get people to talk for about an hour, going through their sort of gallery of photos, but then also a second one in focus groups. So we had about thirds of the cohort of, so about 6 people per focus group to then talk and just select 2 to 3 of their most important pictures and describe what they mean. So we recorded and we transcribed. This is a little bit of what that data looked like. It's not really, it's a lot of words, but what was really interesting was then to match the words with the pictures and to look at what people were talking about. And I've just highlighted 2 of the quotes. This is from a woman who was not a gardener, but lives downtown in Salt Lake and in a tall building, and really found a home in the garden during the COVID because it's a place she could go and interact with other people. She also talked, though, about how within her building, stairwells were really scary. So if you're going between floors and people are not masked, it became an uncomfortable and sometimes confrontational place to be. So it was an opportunity to, with that data, then organize it. So we generate codes, and we're looking at themes, and we could categorize that sort of into these kind of 5 sectors that overlap with the 8 domains. But what we're really looking for is not necessarily like a repeat of the information, but we're looking more for the things that are, this kind of reinforces some of the stuff we know. But we're trying to look for what's new or what's distinct from the COVID. And so I'll just describe 3 of the themes that really became important within this. The first was staying close to those who are close to you. So sort of really thinking about the ability to stay socially connected. And this is a photograph a lot of people talked about adaptation. So thinking about resiliency, not just big spaces, but small spaces as well. This was a woman who ate outside every week with her 2 daughters, and this was a place where this became their living room, essentially. And I don't have control over that, so sorry. I promise I'm not trying to just keep you awake. A second theme was then balancing social connectivity with safety. And so we had a range of people in terms of attitudes towards social confinement, but one of the things that we heard about, whether it was about a physical or functional or kind of a adaptive environment was just the ability to stay connected with your neighbors. And so that became important in terms of then describing the idea of sense of longevity and connection in a deeper sense. It's not just about being able to holler across the street, but really feeling embedded in place. The third was to just get outside and breathe fresh air. And this is literally the quote from one of our participants, but just the ability to find relief, if you will, from the isolation. And this helped us really think about the importance of our open spaces and where they are and how they're accessed. And another one was, 2 more themes, an openness to ideas. So one of the things that within our cohort of participants really was something that was common was the ability of people to pick up new hobbies or learn new things, whether that was reading new books or learning to play the ukulele, but sort of within that context of really being confined within your home, sort of what it was that we could then begin to open up to. And the last thing was the idea of nurturing perspectives through inner beliefs. It was really interesting to hear people talking about aging in place within this theme as well. And it really, to us, spoke to this idea of belonging as being much, much deeper than just an address and a doorknob but kind of a sense of connection. And so just 3 findings from this then. One, it really underscored for us the performative aspect of place, meaning the places we live are not just backdrops like the stage set to your life, but they are very much sort of interactive. And what this diagram is showing, it's a pretty important one from Lawton and Namaro, and just showing environmental press, right? But there's some sweet spot where there's enough challenge within an environment, but there's not too much challenge. But that is always changing for all of us, actually. The second was the importance of third places or sites of significance. So amongst the hundreds of photos that we got, actually about half of them were taken outside of people's homes, whether that was a garden or this was a woman who ventured out to take tracks during the pandemic. And so it was really interesting within the call to talk about aging in place that so many people are talking about place outside of their home, right? It kind of underscores some of the things that we know. But a third one that was then connected to that was really the importance of pro-social behaviors and meanings. And so you can kind of see from this quote that people are defining aging in place as not just necessarily taking care of yourself, but also thinking about connection to community. So this became a really, I think for us, important way to think about that first scale of aging in place and what the relationship is like between a person and their home. And again, this is a small cohort, and these are all people who have apartments or homes, right, which we know was a really, really challenging thing to maintain and to keep up during the COVID, during shelter-in-place orders. But for us, it became then a launching point for a second study, which looked at age-friendly communities as platforms for equity, health, and wellness. And within this project, we decided to look at 3 different types of environments, specifically neighborhoods, campuses, and health systems, because they're all 3, they share the characteristics of having an institutional quality to them, which has leverage, but also having very distinct audiences and different needs. But they are shared amongst places, whether it's in an urban setting or suburban or rural. And so within this context, we designed a 2-day symposium that really looked particularly at the physical and social environments that promote aging well across the lifespan. And this is really premised on then looking at the way that older adults and non-white individuals were disproportionately affected by health, social, and environmental justices coming out of the pandemic, but that we know really compound over a lifetime. So the advisory board, you can see the names of the people in red, many of whom are here, and thank you very much for serving on our advisory board. But we were able to recruit people both nationally and then, as well as then regionally. But the basic research question that drove the symposium was written here, that people live longer and healthier than ever before, but in places that are designed for significantly shorter lifespans. So how can the places we live transform as rapidly as our aging population and create age-friendly futures for our people of all ages? This is one of these questions that we write in school as professors that are wicked questions, right? There are no real good answers to it, but it's an interdisciplinary question, and it requires a lot of thought from people in different fields. And so you can kind of see just from the gestalt of the affiliations of people on our advisory board, it really did take a village to pull this together and to kind of think about curating a set of conversations that looked at these 3 different place types. Our goals, we wanted to have diverse attendance to foster engagement, generate learning. We do have a book coming out in November, and this is too small for anyone to read, but to that point we had about the size of this room, about 113 unique attendees, but from 24 states. And we did do it all online, but we were really excited to have Dr. Terry Fulmer give our keynote address, and within this context, we started to look at the concept of what an age-friendly ecosystem is. And inside of this, and these are just graphic notes from her keynote, and I'll show you ones from our other panel discussions. You know, we talked a lot about age friendliness as a social movement, and just the idea that we all have a stake in this in some ways, but that both from an external perspective and thinking about the messaging around ageism and how that's perceived from the outside in, as well as from the inside out, how older adults often face a really confusing landscape, and how there's a disconnect then also between people who are working at the intersection of those, because we are in so many different disciplinary silos. And while our work is very much concerned with this big set of issues, we have sort of a limited amount of contact that we have with each other on a daily basis. And so it was within this context that we talked about some of the issues facing individuals' communities, and these are responses from our participants. And one of the things, because the majority of people were based in Utah, and it was really focused on the context of aging in the Intermountain West, where we have a lot of rapid urbanization, but we also have deep pockets of rurality. And those create this sort of really different set of contexts within which then we're thinking about affordability, transportation, and connectivity. We're also thinking too about what some of our strengths are in terms of some of the social bonds and the social connectedness, and thinking too about how we better leverage those resources, and sort of framing that within this context of an ecosystem was helpful to think about how things sort of never are disposable, right? But hopefully within an ecosystem, you have closed cycle loops, and that's sort of a goal for what you want to create. So we kind of are beginning to think about how we transform challenges into opportunities and things like that. We dove into then neighborhoods. So Mike Watson from AARP was sort of our national expert, and then Rob Entz and Dr. Keith Diaz-Moore were sort of our regional experts in this panel discussion. And we talked a lot within the context of the Intermountain West and Utah specifically, just sort of the difference that we see in housing particularly, and just how different that housing stock is in terms of then creating the landscape in which people are aging. There's a recognition that we all kind of want the same things, but yet, and our partnerships are critical, and yet sometimes it's the simplest things like walkability and accessibility, which are just overlooked. And we do tend, and I just say it as an architect, to design at the Peter Pan perspective, where we think everybody is sort of able-bodied and about middle age, and we know, in fact, from looking at some important work, such as the 880 cities, right, that we really have to think about both the young and the old and everybody in between, and that we are all aging as well. From here, we looked at age-friendly campuses, and this was really interesting. The University of Utah just received age-friendly designation last year, which is a really important milestone. And within this context, we're talking not just about the campus as a physical place, but also curriculum. We're talking about our lifelong learners. We're talking about faculty and staff, and sort of thinking about the ability to again, sort of create a closed loop system where our curriculum and our teaching efforts are really kind of able to connect to big social and big societal kind of grand challenges. And aging is definitely one of them. So one aspiration might be that everybody who goes to college in some way touches aging, whether you're a math major or a music major, right? But there's some recognition of this as a social issue that will be a defining issue of our times. So that was really interesting to shift that place type to think about some of those issues. And then within the last stop here on age-friendly health, I love this conversation because we didn't talk at all about health hospitals. We talked a lot about health in terms of public health, and really around the perception of ageism and recognizing sort of the toxicity of age discrimination and the ways that has been documented to have a significant reduction in longevity, right? If you have negative attitudes towards aging, there's a whole bunch of really interesting work that shows how implicit bias actually is harmful to individuals themselves. And so kind of within that context and thinking about the public messaging then and how we talk about aging and how we think about older adults as an asset and a source of positive attitudes about aging, as opposed to being detrimental or something to be avoided in some ways. It's a fundamental reframing of the question that's really important. And so it was provocative, I hope. We did a World Cafe, which is another type of research method. And if you've done a World Cafe, You'll know they're pretty fun, they're fast. This was in a virtual context, but it's usually held in a room like this, but where you're invited to be talking and participating and generating ideas and then exchanging ideas. And so within the context of the symposium and this, or looking at this as sort of a research project, it was great to build from that national and regional expertise to then generate the World Cafe. And this is around the time, I think, I'm looking for anyone from the commission in the room, but when we began to talk about the state master plan for aging, and so it became really, it was really timely, I think, in terms of then thinking about how our health, our neighborhoods, our campuses are really connected within this ecosystem model. Some of the things that we prioritized, and we didn't do as big of a thematic analysis with what I showed you on the Photo Voice project, but some of the themes that came out of it were that we do have strong cross-sector collaboration, there's a strong sense of community, and that there's a real desire to promote programs that advocate for wellness across the lifespan, as well as a real interest in intergenerational opportunities, and that's something that I think is so important in moving forward, but then also sort of the list of challenges, and I'm not going to read them because we all know them really, really, really well, but it was interesting to be able to frame these then within that context of thinking about who are your partners then, and how do we find each other, and how does our work intersect. We also did an age-friendly communities student competition, so this was modeled after the TV show Shark Tank, but we called it the koi pond, just recognizing the longevity of the koi fish. And it was a competition that had a cash award, so we had a good amount of participation. Student teams from 5 different schools submitted their videos, and I should have put a QR code, but we had judges, and it was really cool to hear ideas from students, and the only requirements were that they did come from 2 different disciplines, so you couldn't have all math majors doing a proposal, but they had to find people in a different major from themselves. So some of the key takeaways from this project, we're kind of really thinking about age inclusivity and just how and where that starts, and also then thinking about sort of the crosswalks between organizations and systems. I think the one other really important thing here was the concept of the age-friendly ecosystem, and just thinking about how we could talk about age-friendly businesses and age-friendly health systems themselves, as and we can kind of begin to define these different sectors and different ways that aging is contextualized, but then also beginning to think about what weaves us through was really provocative. If anyone's interested, I'll send you a link to the book. It should be out in November. But then our third and final project, and this is something that we are excited to be continuing, but this was led by Dr. Hong. The Nature RX pilot project was looking at barriers and facilitators to implementing nature-based mental health interventions for older adults. So we collaborated with Red Butte Garden on this, and it was really looking at the concept of forest bathing and sort of park prescriptions, right? But looking particularly at the outdoor spaces that we have and the ability to promote mental health amongst older adults. We were looking particularly at access and the design of programs that encourage people to spend more time outside. The research question that drove this study are nature prescription programs intended for members of all society. I'm not going to read all the aims, but you can see the research team that included not just Dr. Hong, but also Talia, who I'll shout out to over here as our PhD student. And so these are kind of the stages of this study. And just by category, this is more of an intervention trial where we are interviewing people beforehand. We're sending them off to do this program that Red Butte does, and then we're interviewing them and doing thematic analysis to try to understand some of the things that stand out to them in terms of the benefits, but also challenges of this type of resource. So this is who we recruited from, and the participants that we had, sort of the overview of demographics, but it was also a smaller cohort of research participants. But I think one of the things that I'm excited to share within the context of this is just also how the motivations and experiences with nature then sometimes ran up against what are the challenges in terms of noise levels, mobility, independence, and access. So these were just images as well from the forest bathing program. Again, just to be clear, like, we did not design this program. This is what nature, or this is what Red Butte Garden is doing. We're just coming in and we're doing sort of a study of the effectiveness and trying to call out some of the themes. So some of the post-interview findings that come out of this include really strong affinity for the social quality, like people really looked forward to being together in their groups every week, but how it was sometimes difficult to hear or move through all the different parts of the garden. And from that too, then were different recommendations for improvement. And this is one of the things that I think researchers are particularly well suited for. I know, coming from my background in professional practice, it's really hard to tell a client sometimes, like, these are your problem, right? But if you have research that's demonstrating it, then it becomes a third party and objective source of input for it. And so those were some of the findings from this. And I think that one of the things too that kind of ties it together is really, at the end, this idea of social engagement and participation with the larger environment. So really thinking about aging in place as not being confined at all to house and home, or even house, home, and neighborhood, but really thinking about it in multiple scales, and how that in some ways mirrors that ecosystem idea, right? That there is sort of a connectivity and a cohesivity to the supports, and that while different place types will have different requirements and different audiences and different things that advance healthy aging across the lifespan, they also support each other. And I think the more that our research can begin to underscore these, and then the more that it promotes dialogue across disciplines and across sectors, sort of the better chance we have at defining really good questions as we move forward in our work. So I'm going to just end with this, and I'm happy to take any questions. I did have one final quote, which is from Gloria Steinman, that revolutions, like trees, grow from the bottom up. And I think this is inspiring within the context of aging and aging in place, because we are both aging locally within the context of our own communities, but also globally. And so in the same way we think about the aspen trees that are all sort of one tree, right? Sort of what happens to one of us happens to all of us. And so in that sense, I love the idea that age-friendly communities represents a social revolution, a social movement, and that it's very much connected between different parts. So thank you very much. I'm happy to take questions.
Okay, great. Now it's time for some Q&A. And again, we have Ryan and Saskia out with microphones. So you can just hold those close so that everybody can hear your question. And it looks like there's some questions over here, Ryan.
So there was a portion of the study where aging adults took 3 pictures a day, and a lot of those pictures were pictures of outside of their home. How much do you think that the role of privacy, or people feeling like sharing too much of their inside home is too private for them to share, plays a factor in those results?
Yeah, thank you. Great question. You know, I think we had a lot of really interesting interior shots too, but I think one of the things that stood out to us was that a lot of the participants that we had were pretty resourced. They had access to computers. They understood how to be on Zoom. They knew how to, or they had somebody to help them upload things. So I think your question is really good because it drives at what did we not see. And I think that we, that we wrote 2 papers that are published about this, and we are pretty clear that it does not encompass like a very representative portion, and a lot more work needs to be done, and different research methods are more appropriate. So we talked about whether we should use the disposable cameras that you can literally send out, and then nobody needs to have a computer, but you send it back into your research team, they develop the photos, you talk about them, you look at them as hard prints, remember like the olden days where you like print the picture, but things like that. There's also ways of doing photos which involves a researcher coming and taking the photos for someone else, or taking movies and things like that. So there's different ways to elicit that information. We were a little bit tied because of the pandemic. We could not go and train people, or we couldn't meet with people in person during 2021. But I think it's a really great question about sort of what is seen, but also what is not seen. Does that answer your question? A lot of the interior pictures were actually written, or a lot of them showed people's kind of personal logos, like a magnet on a refrigerator that had sort of like a life motto or things like that. And so it was really interesting to see sort of what people had around their homes as well to help them adapt.
Not a question. I'm sorry, it's very loud. Okay, so not a question. My name is Andy Hong. I'm working with Valerie on a bunch of other projects, but to follow up with what she was saying, we are doing another study called Nature RX Virtual Reality. So if you know anyone, older adults who are stuck at home but wanting to go out, experience nature, we're trying to bring that to their house, not to the Redview Garden, but using virtual reality. So we're recruiting participants for that research. So if you're interested in finding more about our research, please come and talk to us and take this flyer at home and get the words out. Thank you.
Thank you, Andy. I forgot to put in my plug for that and the QR code, but I think the opportunities, especially through VR, are really important. Yeah.
I did see mobility. I'll introduce myself. I'm John Nardone with WFRC. I did see mobility pop up in one of those graphics. I'm wondering if you could speak to a little bit more if mobility, access to transit has come up in some of your projects.
Yeah, yes, definitely. Mobility and accessibility being 2 really different things as well, right? So thinking about mobility being more connected to different modes of like getting around, or an accessibility being more vertical transportation, as well as then like height changes, like what you just saw me do in terms of tripping, but accessibility and safety being very different than from mobility, like point A to point B. And in similar ways too, some of the distinctions that we saw between around digital technology, right? Accessibility is really different than literacy, right? And so thinking about different ways that we have entry points to mobility and price points to mobility, and that being very different than from accessibility. And while we think of universal design as sort of being something that is aspirational, then also we do have codes in terms of ADA regulation and things like that. So how do we begin to understand what our best practices, and then what are sort of things that are within the context of universal design? Everybody goes the same way, right? It's not sort of like you go here because you have a stroller or a wheelchair, or like the idea of inclusivity, it being like more to accessibility as opposed to mobility being more defined around transportation. So yeah.
I like how that connection you made to universal design and ADA. We were at a conference and someone shared an example of a building that was intended to be bike friendly, but it had a ramp. You could bike all the way to the rooftop, but I'm hearing you talk. That ramp also allows people mobility devices that can't use stairs. Of course, it's a long path, right? But it also allows them access from an exterior entry point. I liked what you said. Basically, everyone can use that ramp.
Yeah,
Right.
yeah, yep, yep. And it's interesting to think too about the things that are really good for the youngest in our population, and how that also connects to those things that sometimes help the oldest, and thinking about the connectivity as well and the benefits that are mutual and that are shared.
I love the concept of forest bathing. Was that the term you used? But as we talk about an urban area with people, with a bunch of planners, can you talk about the role of a smaller local park when, I love the idea of photo bathing, but maybe for a population that's not very mobile, is there, what benefits, or where does that fit in as opposed to a smaller local park?
Yeah, I was just speaking with someone at the break around too the idea of like the pocket parks and neighborhoods, right? And the idea too that it isn't always the big open spaces that people go to, but oftentimes we had somebody take a picture of a bench at 9th and 9th by the whale, for instance, right? And just kind of talking about how that bench meant so much to them, and whenever they saw somebody sitting on the bench during COVID, which is rare, you know, it was just really boosted their spirits. So sometimes too, thinking about the fabric within, like we have our, well, I used to work on airports, and we used to have a metric of the fact that we do have a metric, people walk 4 feet a second, so you can kind of calculate how far you should be able to go within a certain amount of time. If that ranges, like you try to take a 4-year-old or a 94-year-old at 4 feet a second, and it doesn't work, you know? So thinking too about how we have to sort of define what our ranges are, and to your point, it isn't just sort of the Red Butte and the big gardens that are important, but it's very much the pocket parks that then can promote somebody to, or encourage somebody to walk 3 blocks, cross streets safely, but also then find shade, find social connection, come back. It's almost as important to look at the micro and the as it is the macro. Thank you.
I have a question as well. Can you talk more about the value of third spaces and what might make one third space better than another?
Yeah, sure. So with third spaces, and we were really thinking about them within the context of the pandemic especially, so I should just say that most of the third spaces that we found were outdoor spaces, or spaces that were well ventilated and like pretty distanced. So that was the context of what we were talking about within this photo voice study, but then within the context of the symposium, one of the things that we found, so just a year later, right, but somehow the world opened back up, was then really thinking about the spaces that people found on their ways to other places. So people talked about, for instance, like when I was going to my doctor, and then there's a place that I can stop and I can get the coffee, and I can get connected, and I can meet people, and then I can go on to my doctor. So it was almost like having the midpoints, right? So it's not just an out and back, kind of taking from trail language, you know, but then it's a loop. And so sometimes those third sites were really important as the loop connectors, right? So it's not just from point A to point B, but then how do I go from 1 to 2 to 3 back to 1? So sometimes third sites, I think, at least from the research and the findings that we've had, were important as those like synapses, right, that connect us and allow us to then expand. What is your range, kind of, as sort of touchdown places? Seems kind of obvious, but it actually, it's important to be able to qualify it and to collect stories as well as to document it, to then kind of demonstrate it.